Hello, everyone. I'm Sri Banerjee. Had a great introduction from Dr. Su. Thank you for that. So we had a huge team that we put together, some from Walden University's medical school. So these are all the different collaborations, different universities that created this collaboration. All right, so let's go ahead and get started here. All right, so this is the agenda. We're going to talk about the introduction, the methods, results, connection to geospatial findings, and then end with some conclusions. And all right, so this is kind of an abstract, busy slide. This is what I'm going to be explaining. So, all right, so introduction. So before I get started, what I want to kind of give you conceptually is that COPD, chronic obstructive pulmonary disease, so chronic lung diseases, Alzheimer's disease, and poverty. These are the three concepts that are going to be described throughout this presentation. So you can kind of categorize everything according to this, and that's how I'm going to be explaining everything. So the idea is that physical health, the broad kind of concept is that physical health is connected to poverty. So poverty is one of the 5 domains in the social determinants of health, and that is really the framework that public health officials use. How many people have COPD? Well, about 14 million people. 6.5% have COPD. And then in 2023, the official poverty rate was 11%. So already we're kind of seeing, I mean, I don't know if you knew, but that's quite of a high percentage of poverty. So even though that has slightly decreased, that's still a public health problem. So a bit more on chronic obstructive pulmonary disease. One of the reasons that I'm interested in this is because, because this was kind of from a medical perspective. And as you know, those of us who have a medical perspective, this is something that is very common. You get the barrel chest. A lot of people get lung disease from smoking and different disorders. There's actually a genetic marker, genetic source that is there as well. So the prevalence increase among adults 75 years or older. All right, so going into here, Alzheimer's disease, 58 million people. And of course, these are all talks on Alzheimer's disease, so I'm not going to go into that too much. But what was interesting, and I wanted to share this with you, is that there's actually biological science. So I'm a geospatial expert. Well, not an expert, but try to be. And one of the things that's interesting is that there's actually neighborhood level neurodegeneration that's going on so that this is earlier in adulthood. So there are certain areas that's more, certain areas that's less. So why is there a geospatial kind of connection here? So additional findings from Alzheimer's, smaller scale studies showed, like Ruben and his team, that the most disadvantaged areas have a 43% increased risk of developing dementia over 20 years of observation. Study members living in poor neighborhoods, more sort of similar research that shows that geospatially there's variations in not only biomarkers, but MRI scans. So that biologically, and alpha-synuclein, one of our colleagues presented about that, the biological portions of that. So they also scored worse on memory tests and reported more problems with everyday cognitive diseases. So the next question is, why even look at Alzheimer's disease and chronic lung disease? One of the areas that I actually look at is connections between organs. So my PhD dissertation was on relating cardiovascular disease to renal disease. So these crosstalk, this crosstalk that takes place between 2 organs, that is very important. So over here, we're talking about lung disease. We're talking about Alzheimer's disease. So where's the connection? One thing, and this was some of my students came up with this. This is important, is that inflammation is something that affects both organs, right? So this is a very inflammatory sort of disease, and this can actually be a common denominator. Also, allostatic load. I mean, this is probably a concept that you all are familiar with. Allostatic load is kind of like the chronic stress of city living. I mean, there's a lot of noise pollution, violence that takes place, and a combination of that can relate poverty to chronic diseases as well. Of course, smoking causes inflammation, and so that might be a common denominator relating the two organs. So this is actually, I wanted to kind of present you with this. This is actually, I was first author, but collaborations between alumni that I was chair for, another professor, and then also the final student also graduated, and I actually visited his home over here in Minneapolis. But so in terms of inflammation, I was hypothesizing, we were hypothesizing that inflammation is a common denominator. So this shows C-reactive protein has an important impact among people that have COPD. That means that inflammation might be a way to link all of these three factors that I presented: COPD, poverty, and Alzheimer's disease. So here is the method section. So the main premise behind this is we have some numbers that we came up with, right? We conducted a hazard ratio and came up with some numbers. But what do those numbers mean and what do those numbers represent? That's what is important. So in the method section, this was run in the National Health and Nutrition Examination Survey. So this is a all-inclusive sort of data set that has many variables. And what we were interested in is looking at COPD. So COPD was something that was reported by people that were, taking the survey. So you ask them, has a physician ever diagnosed you with COPD? And the answer is yes. So the person will be included into the survey. So the comparator group is people that did not have COPD. So then poverty income ratio. Poverty is something that is important. So this is 100% of the federal poverty guideline. And then you have ADRD mortality, and the Alzheimer's disease-related mortality was actually not self-reported data. That was actually ICD-10 code. So these were more concrete causes of death. So the main meat and potatoes, and I use this for these slides, is that people that have chronic obstructive pulmonary disease (COPD), among older adults, poverty is actually connected to Alzheimer's disease-related deaths. And what were those numbers? The hazard ratio was 5.41. So basically, what we did is started in 1999 to 2010. There were like 6 waves in there. And what we did is took a look at follow-up into December 31, 2019. And roughly the 10 years of follow-up actually provided the hazard ratio. So people that had, this is an adjusted model. So people that had poverty were more likely to die from Alzheimer's disease mortality. And then when you looked at COPD as a moderator, then that value became more. I'm going to show you that. So this is actually with COPD. And then when you're looking at without COPD, the numbers actually go down. So older adults with COPD, they have a higher hazard ratio or higher likelihood of dying than people that were impoverished but did not have COPD. And that makes sense because chronic diseases, the hypothesis is that chronic diseases, along with poverty, not only causes more morbidity and mortality, but also these are causing kind of like look like they're interconnected. So poverty and chronic diseases are interconnected and increases Alzheimer's disease-related deaths. So again, I kind of went over this. Again, this relationship remains strong even after the model was controlled for education, gender, age, ethnicity, smoking status, arthritis, CVD, and CKD. So I wanted to kind of highlight some of these geospatial distribution of cognitive decline versus COPD. So what you're seeing here is areas. So if you can, actually, I'm going to use this pointer. If you can see these areas, COPD is high in these areas. So the dark areas is high in COPD percentage and then cognitive decline. So if you're seeing dark, that means there's a relationship. And as you can see in the South and Appalachia regions, and those are the regions that always light up because there's more poverty, there's more chronic diseases within the South, and then also the Appalachia region. And there's a lot of industries that kind of are no longer there, and that actually increased poverty. And we can surmise that COPD and cognitive decline are related in these areas as well due to poverty. And that's the premise behind my talk. Now, looking at health insurance versus cognitive decline, we kind of see similar patterns. Now, we don't necessarily see the Appalachia region being highlighted. And again, the health insurance was used as a proxy for poverty. That's what was done. This is from Places data set, CDC Places. If you look that up, then you're going to be able to see some heads nodding. So this is really good visual representation of what is happening within the United States and where these relationships are stronger within the country. So as you can see, the whole country is not, it doesn't behave the same way. All right, so let's get through these map findings. I already went over that. So here's the conclusion. There is a strong connection between poverty and Alzheimer's disease mortality. That's a novel finding. In a model to show that, I mean, you can kind of say that, but in a model to show that in a Cox regression hazard ratio, that is something unique. And so from a geospatial context, if these relationships still exist, and our findings said that, yes, there was a relationship between poverty income ratio, COPD, and Alzheimer's disease related deaths. So what did we learn, right? So increasing screening, especially among impoverished individuals for COPD is especially important. And then if you're looking at Alzheimer's disease and screening for that, cognitive decline should be looked at more closely. And then, so Healthy People 2030, this is about 359 objectives. And these are created according to the findings of what is going on within the United States. So more studies really need to be done to understand some of these complex connections that are taking place within the nation. So, thank you for your attention, and hope you learned something.